My name's Tanika. I'm a registered nurse.
Hi, I'm Grace. I'm a nurse practitioner in the emergency department.
I'm Jessica Marsh. I'm a registered nurse in an emergency department.
I'm Joycelyn Shipman Craighead. I'm the Director of Quality for Madison County Operations at Huntsville Hospital.
Hi, I'm Amy. I've been a registered nurse for 35 years. I work in the emergency department.
Hello, Alabama nurses. This is Fred RN, your Vice President for the Alabama State Nurses Association. Well, it's Nurses Week, or should I say, Nurses Month. This month, we will be celebrating nurses all throughout the state of Alabama. And you know what? If ever there was a time to prove that 2020 was the year of the nurse, it's this year. You know, to be a nurse, it truly takes a very special person. And that's why we're spending this time celebrating all of the nurses who have done so much for not just patients, but just for community as well too.
I became a nurse because of my wonderful aunt, April Hill. Back when I was a child, I saw the way that she was able to not only impact the patient themselves, but to touch and reach families in a community in a way that I had never seen anyone be able to do that before. So right then I knew exactly that I wanted to become a registered nurse.
I became a nurse because not only do I love the science of the human body and learning about the way it works and giving that life-saving medicine when it's needed. Of course, I just love being able to help those in some of their biggest times of need and be able to hold their hand or help diagnose them and help treat them and help them to live a healthier life.
I've wanted to be a nurse since I was a little kid. I had this wonderful great-grandmother who was super supportive, and she just helped everybody around her, and I wanted to be like her, helping other people, and nursing was actually a way to help other people on a grander scale.
I became a nurse because I enjoy making a positive impact on people's lives.
I became a nurse kind of by happenstance. Actually, I was going to become a doctor, and my mom was diagnosed with cancer. And through all of that, seeing her on the good days and bad days, being in the hospital, I noticed that the doctors only came in for a few minutes, a lot of times giving devastating news, but it was the nurse that walked us through everything, held her hand, wiped the tears, wiped my tears, and made the difference in a totally devastating situation. And from that point, I knew that medicine was not for me, but nursing was.
So I have a question for you. Why did you choose this profession? What was it about nursing that you felt was a calling for your life? If you're a nurse in the state of Alabama, I would love to hear your stories in the comments below. This is Fred RN, your Vice President for the Alabama State Nurse Association.